Doxycycline is a tetracycline antibiotic. It kills certain bacteria or stops the growth. It is used to treat many kinds of infections like dental, skin, respiratory, and urinary tract infections. It also treats acne, Lyme disease, malaria, and certain sexually transmitted infections. Indications: Doxycycline is an antibiotic that is used to treat infections including chest and dental infections, skin infections and conditions like rosacea, sexually transmitted infections, other rare infections. It can also be used to prevent malaria if you are traveling abroad. Doxycycline is available on prescription. It comes as capsules, tablets, and tablets with dissolved in water, dispersible. How to take, course of administration and dosage. Inside, tablets are dissolved in a small amount of water, about 20 milliliters. To form a suspension, tablets can also be swallowed whole, divided into parts or chewed with water, preferably taken with meals. Take the pills while sitting or standing, which reduces the chance of developing esophagitis or an esophageal ulcer. The drug should not be taken immediately before bedtime. Usually the duration of treatment is 5 to 10 days. Adults and children over 8 years of age weighing more than 50 kilograms. 200 milligrams in 1 to 2 doses on the first day of treatment, when 100 milligrams daily. In cases of severe infections, the drug is prescribed at a dose of 200 milligrams daily during the entire course of treatment. Children 8 to 12 years old weighing less than 50 kilograms. The average daily dose is 4 milligrams per kilogram on the first day, then 2 milligrams per kilogram per day in 1 to 2 doses. In cases of severe infections, the drug is used at a dose of 400 milligrams per day daily during the entire course of treatment. Features of dosing for certain diseases. With an infection caused by S. pyogenes, the drug is taken for at least 10 days. For uncomplicated gonorrhea, excluding anorectal infections in men, adults 100 milligrams 2 times a day until complete cure, on average within 7 days. Or 600 milligrams is prescribed for 1 a day, 300 milligrams in 2 doses, second dose 1 hour after the first. For primary syphilis, 100 milligrams 2 times a day for 14 days. For secondary syphilis, 100 milligrams 2 times a day for 28 days. For uncomplicated urogenital infections caused by chlamydia trachomatis, cervicitis, non-gonococcal urethritis, 100 milligrams 2 times a day for 7 days. With acne, 100 milligrams 1 time per day. The course of treatment is 6 to 12 weeks. Malaria prevention, 100 milligrams 1 time per day for 1 to 2 days before the trip, then daily during the trip and within 4 weeks after returning. Children over 8 years old, 2 milligrams per kilogram 1 time per day. Diarrhea, travelers, prevention, 200 milligrams on the first day on the trip in 1 or 2 doses, then 100 milligrams 1 time per day during the entire stay in the region, not more than 3 weeks. Treatment of leptospirosis, 100 milligrams orally 2 times a day for 7 days. Prevention of leptospirosis, 200 milligrams once a week during a stay in a disadvantaged area and 200 milligrams at the end of the trip. In order to prevent infections during medical abortion, 100 milligrams 1 hour before and 200 milligrams after the intervention. The maximum daily dose for adults is up to 300 milligrams per day or up to 600 milligrams per day for 5 days in severe gonococcal infections. For children over 8 years old weighing more than 50 kilograms, up to 200 milligrams. For children 8 to 12 years old weighing less than 50 kilograms, for 4 milligrams per kilogram daily during the entire treatment. In the presence of renal insufficiency and/or hepatic insufficiency, a decrease in the daily dose of doxycycline is required, since it gradually accumulates in the body, risk of hepatotoxicity. Contraindications: hypersensitivity to doxycycline, other tetracyclines or other components of the drug, pregnancy, breastfeeding period, children aged up to 8 years, severe violations of the liver and/or kidneys, porphyria, lactose intolerance, lactose deficiency, glucose-galactose malabsorption. Special instructions: for most infections, you'll start to feel better in a few days, but it is important to finish the course of medicine. Doxycycline works more slowly to treat the condition rosacea. A doctor can review it after about 4 weeks to check how well it's working. The most common side effects of doxycycline are headache, feeling sick or being sick. It can also make your skin sensitive to the sun. It's best not to drink alcohol while taking doxycycline, because it can stop it working properly. Doxycycline can sometimes cause thrush. If this happens, ask your doctor or pharmacist for advice. Side effects of doxycycline. Like all medicines, doxycycline can cause side effects, although not everyone gets them. Common side effects: headaches, feeling sick, nausea, being sick, vomiting, skin being sensitive to sunlight. Serious side effects: bruising or bleeding you cannot explain, including nosebleeds, a sore throat, high temperature, and feeling tired or generally unwell. This can be signs of blood problems. Diarrhea, possibly with stomach cramps, that contains blood or mucus. If you have severe diarrhea that lasts longer than 4 days, also speak to a doctor. Ringing or buzzing in your ears, pale poo and dark pee, and the whites of your eyes turn yellow or your skin turns yellow. Although this may be less obvious on brown or black skin, this can be signs of liver problems. Joint or muscle pain since starting doxycycline. Severe headaches, vomiting, and problems with your vision. This could be signs of pressure around your brain. Intracranial hypertension. A fingernail that starts coming away from its base. This could be reaction to sunlight, called photoanacolysis. A sore or swollen mouth, lips, or tongue. Severe pain in your stomach with or without bloody diarrhea, nausea, and vomiting. This can be signs of pancreatitis. Difficulty or pain when you swallow, a sore throat, acid reflux, a smaller appetite or chest pain which get worse when you eat. This could be signs of an inflamed food pipe, esophagitis, or esophageal ulcer. During pregnancy and breastfeeding, doxycycline is not recommended during pregnancy. It can affect tooth and bone development in your baby. Talk to your doctor about taking a different antibiotic. If your doctor or health visitor says your baby is healthy, you can take doxycycline for a short time, less than 3 weeks, while breastfeeding. Taking doxycycline with other medicines. Cautions with other medicines. There are some medicines that do not mix well with doxycycline. Before taking it, tell your doctor if you are already taking any of these medicines. Indigestion remedies, antacids. Stomach ulcer medicines that contains bismuth, such as pepto-bismol. Other antibiotics, such as rifampicin. Acne medicines containing vitamin A, such as isotretinoin. Warfarin, a medicine to help prevent blood clots. Medicines for epilepsy, such as phenytoin or carbamazepine. Cyclosporin, a medicine that calms down your immune system. Take this medicine exactly as directed by your doctor. Do not take more of it, do not take it more often, and do not take it for a longer time that your doctor ordered. To do so may increase the chance of side effects.